cloud. Okay. Okay, so really quickly before we start, I want to let everybody know that the quiz is going to come up. It's scheduled to come up at 4:20, so as soon as the class is over, the quiz will be there, and it's going to be over my last 2 lectures and this one. 5 questions like usual. And I think that's it. I think that's the only thing I wanted to mention. Oh, it's Earth Day.
It's Earth Day, yes.
So that's cool.
Yes.
I've got my Earth Day shirt on.
Oh, nice.
So.
Yeah, that's great.
The word of the day, that's a good idea. Oh, and when is it due? Okay, these are both great questions. So the quiz is due 1 week from today. Oh, that's not true. I'm totally lying to you. It's due on Monday, midnight on Monday. And then also the word of the day. Yeah, sure. Earth Day can be the word of the day. That sounds good. And that's all I've got. So I'm going to mute myself and turn it over to you. Thank you very much for doing this, by the way.
Oh, of course, yes. Thank you for having me.
Of course, absolutely.
Yeah, thank you. I see about 20 plus students. Is that right?
Yeah, we're around 30, and that's about right.
Okay. And the idea for doing this is that the students get a chance to ask questions, hopefully we'll have a discussion about it. Of course, I'm assuming you've already posted the PowerPoint, right? So
I think they're up. I'm going to check on that.
Okay.
They might not be visible, but I'm going to have to run in and do that.
Oh, okay. Okay. So the students, you guys have access to the PowerPoint that I'm going to use today. And in the notes section of the PowerPoint, I have typed out the main points that I would like you to know about each slide. So basically, as I said, the goal for the Zoom meeting is so that we can talk about it a bit, and you can tell me maybe about your experiences with Aural Rehab, ask questions and such. So from the perspective of just content, it's available in the PowerPoint. Okay. All right, so I am a clinical associate professor in audiology. That means I teach courses in the graduate program in audiology, the AUD program, and I also work with students who are gaining their practicum hours in our clinic. So we have an audiology clinic where we see clients from the community, and they come in for hearing services. So I work with students who are gaining hours. Okay. My topic for today is aural rehabilitation. Okay. I'll go over the definition of aural rehabilitation. I hope to have a discussion about it. And then I will talk to you about aural rehabilitation or habilitation for the different age groups, because it is different for children who have not yet acquired language when compared with adults who have already acquired language and may be working. And of course, those techniques may be different from what we may do for adults in the elderly age range. So we will talk about each age group and talk about issues most prominent in each age group, and techniques to work with these populations. I also have some information about the deaf culture. Okay, so starting out with what is oral rehabilitation? Okay, just thoughts. You can unmute yourself and um, do they participate? Can I get them
They
to?
do. A lot of times they'll come through the chat, and so I'll
Oh,
man the chat and I'll relay questions to you.
yeah. For some
But if
reason, I'm
anybody
not
wants
able
to,
to. Oh, sorry. For some
oh,
reason,
go
I'm
ahead.
not able to see the chat. Can you tell me? Did I lose
Oh
it?
yeah.
Maybe
So
I just.
that when you're
Yeah.
sharing a screen, it's in
Okay.
that upper bar near that
Yeah.
green.
Actually, I got it. Okay.
Okay.
Yeah. It went away and then I got it. Okay. All right. So yeah. Do you guys want to share your thoughts about oral rehabilitation? Anyone at all? Um, So I will share with you what I have about oral rehabilitation, the definition of oral rehabilitation. Do you still use that same textbook? I have the textbook definition on top.
Yeah. Yeah, we do.
Basically, it's intervention that's aimed at minimizing and alleviating communication difficulties. So the goal is to improve communication for the individual with hearing loss, and the goal is to lessen communication difficulties for the person with hearing loss, their family members, and other individuals they interact with, maybe at work, maybe in the community. So all that is oral rehabilitation. And you will notice here that I've highlighted communication abilities. Okay. So what about music? What about other sounds in the environment? Thoughts about that? Do we want our individuals with hearing loss to enjoy music? What keeps you connected to the environment when you're taking a walk outside? What are the sounds you hear? Okay. So far, we have always focused on communication. Okay. Um, because communication has impacts with respect to education, for example, respect to work. We usually don't think about, say, music or staying connected to the environment the same way as we think about communication. But you know that it does contribute to quality of life. Enjoyment of music contributes to quality of life. So today we are looking at how we can optimize music, how we can optimize interventions to help them stay connected to the environment that's listening to sounds in the environment. It may be the birds chirping, it may be the water running, things like that. Okay. So any comments at this point? Anyone at all?
Do you have that video that you showed last time? Is that in your PowerPoint?
The video.
With it demonstrated hearing loss for a certain song.
Oh, yes, you're right.
I'll pull it up. If you don't have it, I'll post it to Ken.
Yes, I don't have it here,
Okay.
but yeah, that's a powerful video.
It
It
is.
comes up on YouTube. If you just type in hearing loss simulation, it's
Okay.
yeah, it's one of the top videos that comes up.
Great.
Yeah, it
Okay.
was a song. It was a song, and it showed what happens when you have hearing loss. Yeah, that'll be a good one. Yeah, that'll be a good one to show. Yeah, if you can't find it, let me know. I'll find it for you.
Okay. Thank you.
So yeah, so we focus on the speech signal. We focus on communication. But remember, today we are also interested in other sounds in the environment. And basically the goal is to improve quality of life. Okay, so how do we achieve this? How do we do this? We do this by obtaining a thorough understanding of the individual's needs. So we start off with the full hearing test, start off with amplification, which is also part of AR, but I'm not going to focus on amplification here. I'll talk about what happens after hearing aids or what happens after a cochlear implant is programmed. Okay, have you already had that lecture on amplification and cochlear implants and such? Maybe not yet.
Not yet. That's the very next one.
Okay. Okay. So yeah. So oral rehab typically comes after that. So if an individual needs amplification, then we try to get them hearing aids or cochlear implants. If we're about making speech accessible or making music accessible or making other sounds accessible in the environment. So it's understanding their needs, and then it's a lot of counseling. So hearing loss affects emotional adjustment. It affects psychosocial well-being, and it takes a lot in terms of adjusting to the environment, to the devices, and today we are still experiencing stigma with respect to hearing loss. So it's all of that. So it's a lot of counseling. And the last one, of course, is we want to maximize communication success. Okay, so we want to know what their everyday environments are like. For a student with hearing loss in a classroom, it's different from an adult who may be working in a group situation. So their needs are different, their environments are different, and we try to understand what their acoustic environment is like, what their listening environment is like, and we try to provide strategies based on their environments. So the treatment we provide is holistic. We try to take care of psychosocial, emotional issues. We work with devices, make sure the devices are optimized and the signal is coming through as well as we can get it. And of course, then we work with communication. Okay, so let me ask you a question. What would be one take-home point from the couple of slides we've been through? Anyone here?
Avery says, oh, there's a whole bunch that just came up.
Oh, okay.
You have the chat up right now or no?
Oh, yes, I do actually.
Okay.
Yes. The main goal is to, yes, I see that. Oh, that's great. Thank you so much for this interaction. I don't do very well without having that face-to-face interaction. At least this is helpful. Yes, great. So it's not just communication, connection to the environment through nature, sounds, music. That's great. So yeah, think about all the sounds you're hearing each day. Yeah. Yes, excellent. Thank you, guys. That's great. So now we're going to move on and talk about interventions for babies with hearing loss. Okay. So that's my next slide. Habilitation for infants and children with hearing loss. So you notice that I've used the term habilitation here, and generally I've used the term rehabilitation in my previous slides. The main difference is that when we're talking about babies who are born with hearing loss, they've never experienced a period of normal hearing. So we are not rehabilitating. The idea is that we are providing these interventions for the very first time. So it's habilitation. So that's kind of the strict definition of habilitation. But to tell you the truth, in the literature, you will see the term rehabilitation being used even with respect to the infant population and with the pediatric population. They use it synonymously. Okay, so today we are able to identify babies with hearing loss because they are screened at birth. All babies are screened at birth, so we can diagnose them early and we can intervene early. And the goal is to actually start intervention by 4 months of age. And they're able to do that today because hearing screening is mandated. And once we know that the infant may have a hearing loss, so if the baby does not pass hearing screening at birth, we have a system in place to get them through the next steps, which is diagnosis, amplification as necessary, and enrollment in an early intervention program. So there are federal programs to provide early intervention for babies and families who have a baby with hearing loss. Okay. So when we're talking about babies with hearing loss, the main goal is to help them develop language, okay? Because in those very early years, that's basically what they're doing. They're soaking up language that they're able to hear. And when we're talking about language, this slide lays out the different methods, the different communication methodologies available to help babies acquire language. Okay. And you'll see on the left, we have the auditory verbal mode, and then all the way going to ASL on the right side. So in a very strict sense, auditory verbal intervention is when we provide therapy through the auditory modality only. In fact, it is so strict that therapists may even cover their mouth and not provide any visual cues. That's strictly the auditory verbal approach. But even just listening to me talk about it, you know, that's not naturalistic. In everyday environments, babies are exposed to the auditory signal, they're exposed to body language, facial expressions. So it's natural to have more than just the auditory input. And the auditory oral methodology aims to do just that. So with the auditory oral approach, basically we are providing them with whatever is available naturally in a communication context. So on the left side, these are heavily weighted towards the auditory signal. The primary mode of language learning is through the auditory channel. We want to make sure the baby is fit with appropriate hearing aids or cochlear implants. So it's very important that we have the appropriate devices so the child is receiving the best auditory signal that they can get. Okay, so these are heavily weighted towards the auditory signal. And then we move towards other methodologies that use more of the visual cues. All the way to the right side, ASL, of course, is a visual language system. Okay, and total communication uses just anything and everything that works for a child. So they may go all the way from the auditory verbal approach to ASL within the same session. Okay, so total communication is anything and everything that works. And cued speech is kind of in between, where cues are provided to disambiguate sounds that look alike at the face. So this may be pa, this may be ba. There are specific cues that are used at specific positions to cue the auditory signal coming through. That's cued speech. And then in there, somewhere in there, we also have finger spelling, where we have specific signs for each letter of the alphabet. So this is giving you the whole range of options that we have to teach babies language. Okay, so to provide them access to language, we go all the way from an auditory only type of approach to all the way a visual only type of approach, and we have many options in between. Okay, questions at this point? No questions? I will show you this. This actually lays out what I was talking about earlier. Here, it's showing you that the auditory verbal approach is a totally auditory approach, as I was telling you earlier. And then mostly auditory approach with the auditory oral modality. Then we have cued speech, and then using more of the visual signal for communication up in this region. Okay, so if you have no questions, then I may ask you one. So maybe you should ask me before I ask you. Any questions at all? How do we decide which approach to use? Thoughts about that? How do we know? How do we decide? I kind of gave you a framework. Yes, so somebody said, depends on amount of hearing loss. Good point. I kind of gave you a framework earlier, remember? Think about the individual, think about the family, the support system, right? So definitely depends on the amount of hearing loss. Good point. What are other factors to think about? So I gave you a clue. Think about the family, right? So we work with parents. Is the goal to do an AV methodology, or is there a preferred methodology? Yeah. So the question is, yeah, if they have other conditions, good point. Yeah, do they have other associated conditions? Obviously, you know, looking at amount of loss, if it's an aidable loss, if you can aid it well, say a moderate loss, obviously it's easier to aid them. It's easier to get that auditory signal through, and they're more likely to have an auditory modality for language. Good point. Ask the parents' choice, right? what are they comfortable with, what's possible in their family. Yeah, and individual capabilities. So the goal is not always an AV methodology. The goal is to find the best approach for each individual family. But you're right that certain conditions may help us decide right away. For example, the amount of loss. That's definitely, you know, it's an easy one to think about. If they have hearing left and it's an aidable loss, more likely they will choose an auditory approach. Whereas if it's a baby with severe to profound loss, not doing well with hearing aids to begin with, and then the family has waited to get a cochlear implant, so you know they've waited for some time. If there are additional conditions that may complicate intervention or rehabilitation, those are factors to consider. We may choose a visual approach. We may even prepare for a tactile approach in some cases if we know that there is progressive loss, maybe there's vision issues. We may also use a more tactile type of approach. Yeah, so good points, you guys, in the chat. Yeah. Depending on which method will be most successful in their everyday life. Good point. Yeah, so think about, yeah, what support system they have. And we will talk more about auditory only versus visual later. But yeah, what do we know about outcomes with interventions, right? So this is something we can share with the family and make those decisions. Okay. Good points. There is a lot of literature out there on outcomes, language outcomes in children who have received early intervention. That's why it's so important to start early, because we know that if we start very early, if we can get that auditory signal in, they can develop language through oral means. Okay. And also the likelihood of success learning any language is increased when we start early, even if it's a visual system, you know. If we start early, they're going to be better in terms of their receptive and expressive language skills. Okay. Good point. Thanks for sharing. Thanks for sharing that information. Okay, so now I have a bunch of videos for you. I'm not going to go through these here in class, but I want you to click on these links, and there's also a short explanation under some of these videos. There's a short case study associated with this video. So take a look at that, and you'll get an idea of how therapy is done, how communication is achieved in everyday life when we start early with these babies and families. Okay, so some questions here. What are some pros or advantages of American Sign Language system? Are there any drawbacks of using a visual only communication method? Need interpreter? Yep. A drawback is that not everybody understands ASL. That is true. Yes. I wish all of us would learn ASL, but you're right that sometimes even parents are not proficient in ASL. So obviously then the child's language growth is affected. So that is probably the biggest drawback. that even parents may not be familiar with ASL. They're learning it themselves along with the child. They're not proficient, and then language skills in the child is affected. Good. Yes, the advantage is that it allows them to have a method of communication. Good point. So for somebody who is forced to use a visual method, it allows them to have a method of communication. Good point. Okay. Good, thanks for sharing. Now let us talk about adults with hearing loss. And here I have this website called hearstrong.org. I suggest you browse through this. They have a number of case studies of adults with hearing loss and the amazing things that they've been able to achieve despite their diagnosis of hearing loss. And they also talk about their struggles, what challenges they've overcome, and how they've adjusted to life after hearing loss. So now we're going to move on to the adult population. Now remember, the one big difference is when we're talking about babies, they have not yet developed the language system. So we're focused on language, and here we have adults who are postlingual. So they've completed their language learning years, and most of the time, you know, they're in college and or in a career. Okay, so think about this case of an adult being affected with sudden hearing loss in both ears, bilateral hearing loss. Okay, how might that affect education and goals, career goals? So let's think about, say, college age. Thoughts about that? What would you miss if you plugged your ears? Think about that. Yeah, so communication with peers is affected, and peers may not understand them. So let's talk about this a bit. So here we're talking about speech production, right? When you're talking about understanding, the degradation in speech production may not happen that rapidly. Okay, so definitely they may not be able to understand their peers or the professor in the classroom and such, but production may not be affected right away. I mean, we do have research to show long-term degradation in speech production as well, but may not be to the point where others cannot understand their speech. Okay, so I just wanted to kind of it can affect somebody emotionally, mentally. Yes, it can have a big impact emotionally, psychosocially. Yes, it does. Yeah. So communication is affected. Long term, yes, speech production may be affected. Need time to adjust, need support, need time to adjust. Yes, good point. So what are signs of hearing loss in adults? They may complain about others mumbling. The most frequent issue is, of course, having to ask others to repeat, okay? Saying what, all right? Phone communication is affected. Family members may complain that the TV or radio is set too high. And of course, psychosocially, they may be withdrawn. Okay. Just talking a bit about prevalence rates. Of course, hearing sensitivity drops with advancing age. In fact, the earliest that people notice hearing issues is maybe in the 40s even. Going into 50s for sure, and then by age of 75, about half the general population demonstrate hearing problems. But before I move on to that, we were talking about individuals in the working age group. So really in that age group, pay attention to what their needs are. If it's a college-going student, find out what services are available through the institution, through the educational institution, contact disability services, provide access through amplification devices or other assistive technologies, and also communication strategies. And we will talk about some communication strategies later on, and that's applicable to all of the adult population. So communication strategies for them. And another important skill would be self-advocacy. You know, helping them to adjust, helping them to ask for accommodations to be made. So self-advocacy is also an important aspect for this population. Okay. So before I move on to adult age range here, questions? Tom? Thoughts? Okay. So now we're going to move on to the older, kind of senior age group. Okay. And these are individuals who may be close to retirement, or it may be post-retirement as well. Think about a grandparent. You've had an older relative. You probably had experience interacting with them. What types of communication problems are seen in that population? Yeah. Have you had an uncle, an aunt, an older uncle or aunt talk to you about their hearing aids? A hearing aid is not fitting well. Trouble. Oh, good point. Chris, okay, that's your professor. Trouble ordering in restaurants. Yes, good point. That is one of the biggest issues, listening in noise. And yeah, a lot of misunderstandings. Yes. My grandfather needs to have things repeated. Yes, perfect. Yeah. Trouble on the road or driving. Yes, sure. Not wanting loud noises. Yes, they may be sensitive to loud sounds. Yeah. Yeah, that emotional piece, right? Getting a little paranoid and thinks people are talking about her. Yes, thanks for sharing. So all that is, yeah, all that is good. Exactly, and one of the most common problems is listening in the presence of background noise. And I have to admit, these days, even I have given up trying to figure out what someone is saying from the next room in my house. I just don't even try, and I don't have a clinical hearing loss yet, nor do I have hearing aids, but my hearing, I know, is not just as sharp as it used to be when I was your age. So I've kind of lost the sharpness, and I will, as I said, I will not even try to figure out what they're saying if the dishwasher is on, or if somebody is talking from the next room. That's difficult. Yeah. Okay, thanks for sharing that. So then adults have to be oriented to new devices. Okay, hearing aids today are basically small little computers encased in the device. So a lot can be done, and also thankfully a lot can be automatized as well. But it does take some adjusting to putting it on. Today we have rechargeable devices, but many still have the batteries with the hearing aids, so it does take changing batteries. And just trying to know what common problems are. For example, if the receiver of the hearing aid is clogged with earwax, which is natural to have in the ear canal, then the hearing aid will not function properly. So just for them to be able to troubleshoot those small problems as well, right? So getting used to the device takes some time, and they need support during the first 4 to 6 weeks. So it takes about 4 to 6 weeks of full-time use for individuals to adjust to new devices. And then there is this issue of adjusting to life with the hearing loss and the hearing aids, right? One good thing that has happened recently are all those devices, the wireless devices that youngsters use in their ears. So it's kind of really a cool thing to have things in the ears. So hopefully that will help us. That will help us to fight the stigma, and hopefully adults will embrace hearing devices as well. But until recently, it was not really cool to have things sticking in your ears. Right, so, and I think adults think it's a sign of aging. It's hearing aids are associated with aging, and in some cultures that's not as accepted as in other cultures. Like mine, people are happy to age because because older adults are respected in families. Okay, and then we have assessments and intervention for residual communication problems. Okay. So we can perform an assessment to see how well they're using visual cues. Some are naturally good at using visual cues, some are not. So there are tests to check speech reading abilities. There are tests to look to see how well people do in noise. There are now training programs we can offer them to help them with listening in noise. Okay. Okay, any thoughts at this point? Any comments or thoughts? Communication strategies. These strategies are applicable to all adults with hearing loss. In fact, may be applicable even to individuals who do not have a clinical hearing loss. So think about your own situation when you've been, say, at a noisy party or a noisy venue. What do you do? What have you done? I'm sure you've been in a noisy setting with friends, with family, right? I like that. Somebody is being so honest. They said, just say yes. Yes, okay. Yeah. That is a common strategy that can get you into trouble. In fact, most of our older adults do that, and yeah, it, it 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 has gotten them into um, deeper and deeper trouble.
I've done
But
that and
yeah.
ended up teaching a thing, an extra thing I didn't mean to.
Yes, sure. I can do that. Yes. Yeah. Yeah, I've done that too once or twice, but only with people I think I may not see ever again. You know, like, you don't want to do that if you think you're gonna, with people who are close to you, your colleagues who can maybe get hold of you to teach that class. Yeah. You put your ear next to somebody's mouth, laugh, and hope it was a joke. That's too funny, you guys. Asked to repeat, yes. Yep. I would just nod, say yes. Yeah. So what you're describing is a very common strategy. People do just bluff, and that's one of the first things we try to teach people in our communication strategies class. Do not bluff. There are ways to ask for a clarification um, uh, in a courteous way. You can rephrase, you can pose a close set question. So instead of saying, where are we going to meet? You can say, are we meeting at a Starbucks or Caribou? Yeah. So give them, give them a way so you're controlling the outcome, so to speak. So asking close set questions, checking to see if what you comprehended was right. So yes, that's one of the things we try to teach our participants in our communication strategies program. So this is the communication strategies program I was talking about. It's our adult AR groups, and typically we have adults who may have just received hearing aids, somebody who's been using it for several years, maybe people who are just even contemplating a hearing test, who've not taken that final step yet. So everybody is welcome, and we educate them about hearing loss, about permanent hearing loss, which is associated with aging. We talk about common reasons for hearing loss, common causes of hearing loss, hearing aids, how they work, how well they perform, and then communication strategy training is where we talk about strategies to help them. One very simple thing you can do if possible is actually to maybe go to the next room, move away from the noisy area. If it's something important that you want to talk about, if you know the topic, so figure out the topic. One simple thing that can be done is to move away from the noisy area. We also talk about reducing the source of noise, if that's possible. Using appropriate strategies to make sure that your understanding was correct. And use visual cues. try to use body language, you know, all the cues you're getting in that environment. Okay. So that's communication strategies. We also talk a lot about hearing aids because people think that you stick the hearing aids in and they should be able to hear like normal, right? But it doesn't work that way. Have you ever thought about it? Hearing aids don't work like glasses, although I have to say with my bifocals, it took me a whole month to adjust to my, to my bifocals. But overall, adjusting to hearing aids is not the same as adjusting to glasses. Have you thought about that? Anyone? You want to find out the answer for me? I let them look into it and I can give you the answer later. And you can, but it's an interesting question, I think. I'll let them find the answer. So in our communication training program, we also talk about speech reading, how to use visual cues that are associated with speech, talk about communication strategies, and we also spend a lot of time talking about emotional issues. What is the number one issue that people will report, people with hearing loss will report? And somebody brought it up here earlier, I think. What is a major emotional issue that people with hearing loss experience? Anyone? Thoughts about that? Someone mentioned being paranoid. Yeah, the sense of isolation. Yeah, hearing loss is isolating. Yeah, and from that arises all these other issues, depression, paranoia. Yep, right. So it's a condition that isolates people. I remember this one statement that a patient had told me a long time ago. He had received one cochlear implant, but he wasn't doing well, and he was scheduled to receive a second cochlear implant. And he said the number one emotional issue for him was that he feels like a stranger in his own family. So that tells a lot, right? So isolation is a big issue. So one of the advantages of having a group program is that other people, individuals with hearing loss, can interact with, participants can interact among themselves, and that's a big source of support when they're talking about their challenges. And sometimes they've come up with solutions that I wouldn't have for them, because I've not experienced hearing loss firsthand. So that's one of the big advantages of having a group. Today, there are several online groups as well. So we want to definitely connect our clients with a support group to help them manage to some extent their emotional issues. Okay. All right, so before we move on to the deaf culture, you want to summarize a couple of take-home messages for me, take-home points? So we've kind of covered adults with hearing loss. We've covered adults in the workforce. We've covered rehabilitation for elderly adults. What are a couple of main take-home points? Can type anything at all. I think we've talked about a lot. What are some intervention strategies we can use with adults?
Jessica's got a good point that we take hearing for granted, which I think is.
Oh, yes. Yes. Yeah, that's a good point. You're right. Yeah, we take it for granted. Yes. And another quote I really like is that hearing loss is invisible, right? So even babies, they're born with the perfect pinna, and they may have hearing loss, but there is no way to tell, right? Yeah, it's invisible. That's why I think people think they can bluff and they think that that situation will vanish, right? You really can't tell by seeing an individual. Yes, you're right. That's a good point. Okay. So think about the couple of take-home points. I'm going to ask you after I finish these slides here. I'm going to talk to you a little bit about the deaf culture. You've probably heard about it, the deaf with a big D, right? We use the term deaf or hard of hearing, but we don't use this capital D. When we use the term deaf or hard of hearing, we are referring to deaf as a degree of hearing loss. We are referring to deafness as severe to profound deafness. Okay, that there's very little usable hearing left. But deaf with a capital D, the culture, they look at deafness not as a pathology, just as a difference. So they actually use deafness to connect with each other. And the idea is that if a baby is not born with hearing, if a baby is born deaf, the baby has not lost anything, you know. So it's kind of moving away from the perspective of pathology, but embracing the deafness as a culture or as a difference. Yeah, so you may have heard that there is the deaf culture that exists in everywhere, several cities everywhere, and they have their own identity. ASL is their primary language of communication. They consider themselves to be part of the linguistic minority. They really value being part of the culture. Individuals who are deaf may kind of go in and out too. So I have known some individuals who say they are the only ones who's deaf, the only individual who's deaf in their family. So their family may know some ASL, but they like to interact with members of the deaf culture, and they're part of it. So they can go back and forth as well. But yeah, those members do enjoy the support they receive from the deaf culture. So yeah, so this exists as a community and as a culture. as well. Their primary language is ASL. They may not even seek amplification devices. Some do have amplification, but they still consider themselves part of the deaf culture. They use amplification mostly for environmental awareness, for safety purposes. They're not using it for auditory oral communication. Okay, so that's the big difference between deaf as part of the culture and deaf as part of just hearing loss. Okay, so yeah, we are kind of at the end here. Back to take-home points or questions you may have about any of the slides we have discussed today. Even if it's not related to AR, oral rehabilitation, if you have any questions about audiology, about audiology at ASU, audiology in general, I'm happy to answer some of your final questions. And I know you have a quiz, so I will give you some time to make that mental switch and get ready for the quiz.
So before we do questions, you guys should unmute and give her some applause.
That's great. Thank you.
Welcome.
Thank you.
Thank you. That's special. Yeah. That's special. Thank you. Yes. Yeah. I may see some of you in 401, I think. I may. I'm teaching that in the summer. Any of you taking 401 coming up in May? Maybe not. That's okay. Next year, okay. Maybe I'll see you next year. Yeah. Oh, yes. Are you personally able to communicate via ASL, and what are some tips for those trying to learn? Okay, so I do not know ASL. I will admit that I do not know ASL. I did take some courses when I was doing my master's. That was a long time ago. I never used it. So I'm not good at it. I wouldn't be able to communicate via ASL. For those who are trying to learn it, basically, I know you can take formal courses, but the key is to use it. So, find groups you can be involved in if you want to keep up your skills. I think that's like the biggest challenge. You can take courses, you can learn it, but if you're not using it regularly, then you're going to lose it. So that's what happened to me. And I grew up in India learning 4 languages. So I have 4 language systems in my head. And you can imagine learning ASL was challenging, and I was really not good at it, and I didn't keep up with it. So I do not know. I do not know ASL. But good question. Yes, it's a good skill to have. It's definitely a good skill to have if you're going to be, especially in speech and hearing. even as a member of the community, it's a good skill to have. I had seen this video a long time ago. It may be on YouTube, wherein they talk about this small town somewhere in Europe, where there was this guy with hearing loss, and the whole town learned ASL, not ASL, whatever was that local dialect of sign language, to communicate with him. The whole town. So this one day, the sister takes him out, and the guy at the grocery store has learned it. The guy at the post office has, so everybody is talking. Everybody is communicating via ASL. It's just such a touching. It was so touching. It's a touching video to watch. It may be there online. but it's a good skill to have for sure.
I'll try to find that and post it on our Canvas page.
Yes, yes. I think it was actually put together by one of the tech companies.
Oh, okay.
They kind of, yeah, they kind of garnered support, and they trained the community members, and they made this video, and yeah, I'll look for it too. I'll look for it too, and I'll
Okay.
send it to you. Yeah, it's a touching video. Fun. Okay, any other questions for me? Well, you have my email. You can give them my email if something comes up.
Absolutely, yeah.
And yeah, and I'll see some of you in 401 at some point, I think. Thank you so much for this opportunity
Yeah,
to
of course. Thank you for
here
thank you for the
with
lecture.
you. Oh, of course. Thanks. And yeah, it was fun to have this chat, and just doing this online, this whole new medium.
Yeah, yeah.
Yeah.
Totally different.
Thank you. Thank you,
All right.
guys.
I'll talk to you soon.
Yeah. Bye-bye.
Bye.
Bye.
And I'll hang around for a few seconds if anybody has
Okay.
questions about the class, and
Okay. Then they have the quiz. Okay, I'll
yes,
be
and
in
then the
touch.
quiz.
Yeah, I'll find those. I'll try to find those videos for you. I'll send you the links.
Perfect. Thank you very
Okay.
much.
Bye-bye. Bye.
Bye.
Hey, Dr. Patton, what's our next class?
The next class is hearing amplification and cochlear implants.
Right. Are you doing that one, or is that a guest lecture?
It is me.
Okay. I'm just wondering if I should also go ahead and make an announcement in class to see if anybody would be interested in a.
Oh, sure.
Session. I'm going to send out an announcement, but I don't know who sees that and who doesn't. And
Yeah, it depends on their settings, so I'm not sure everybody sees them. But yeah, go ahead and totally make an announcement at the beginning of class.
Okay, maybe I'll do that next week then.
I'll try to remember, but
I know.
in case I don't, just
Yes.
let me know.
Okay, sounds good. Thank you.